You have pain in your butt, hip, or low back that may or may not shoot down your leg. Your physical therapist, physician, or chiropractor diagnoses you with Piriformis Syndrome. But there's a few things they're not telling you or even checking to help you with your recovery. When I was a younger therapist, I would take people down the traditional path with spotty results. Once I realized these important differences, my results with patients skyrocketed. Rotation is one of the most important features of your hip, and how much your hip can rotate internally or externally will determine how well you can function and how much stress there is up the chain into your back and into your piriformis. How much your hip can rotate is due to much more than just your tendon and muscle flexibility. Anything in that 5 to 20 degree range would be considered normal, with more than 20 degrees being anteverted and under 5 degrees being retroverted. This can affect how much your hip's able to rotate. We'll talk more about that later. Let's get into the piriformis muscle. The piriformis is an external rotator of the hip. So why on earth do we externally rotate it when we're trying to stretch it? Once our hip passes about 60 degrees, that piriformis muscle changes from an external rotator to an internal rotator. This is what allows us to stretch the muscle when our hip is flexed up to that 80 to 90 degree position and we externally rotate the hip. Think of it like this band is the piriformis and this is your thigh. And in this position, it's a closing muscle of the hip. But then as soon as this band gets in line with the door and it switches axis, now that muscle becomes an opening muscle of the door. So depending on which angle it's on, it's either a closer or an opener, just like our piriformis is either an external rotator or an internal rotator. Therapists will understand that concept, but then they'll turn around and test or attempt to strengthen the piriformis muscle in sitting by externally rotating the hip with resistance. Simplest way to determine if you have a version in your hip and which one is to see if there's more than a 15 degree, preferably 20 degree difference between internal and external rotation of your hip in both prone or lying on your stomach and sitting. Now, if you just found out you have some type of version in your hip, not to worry. You're not going to be able to stretch out your bones, of course, but you can just simply make some adjustments to your lifestyle and how you go about doing certain activities. For example, if you have a retroverted hip on the left, all that means is it's not going to internally rotate as well as it will externally rotate. That's what I deal with, especially on my left side, and I can't turn into this hip as well. So I just compensate by opening my foot up if I were to be doing something where I need to rotate repeatedly to the left. If I don't do that, it's going to cause problems up the chain, give me piriformis issues, low back, herniated discs, things of that nature. So all that can be avoided if you know your anatomy and you make the proper adjustments. If you want to stretch your piriformis effectively, you can do it in that classic position where your hip's flexed and you externally rotate the hip. Now, if you want to do it in a position that's a little more functional so you can attack the standing version, now you'll need to internally rotate your hip to get the stretch on the piriformis since the axis is now changed. Think of this as more of a general hip internal rotation stretch than a specific piriformis stretch. Now, this is a really complex topic and I was hoping to give you just an introduction. Subscribe to the channel for more details and to help me cut out unnecessary surgeries and opiate use by focusing on the root of problems rather than just the symptoms. There's more to your butt pain than the piriformis. Click on this video up here to watch a way to strengthen your hamstrings with Nordic curls.